Okay.
Good morning to Dr. Yu and also my fellow friends. Today we are going to present about based on clinical microbiology, and the article we have chosen is Laboratory Diagnosis of COVID-19 Current Issues and the Challenges. Three of the members are from our group. Firstly is Nurul Ashikin, Nurriansyuhadah, and also me, myself, Divya Varshini. Next. During the COVID-19 outbreak, everyone had a major impact on the clinical microbiology. So this commentary covers current issue and the challenges of the laboratory diagnosis of infection that caused the severe acute respiratory syndrome coronavirus, which we call as the SARS-CoV-2. Secondly, the current recommendation for the laboratory diagnosis for the COVID from the CDC that clinician coordinated for the test to the local public authority or else the CDC. So the preferred testing that has been done for the COVID-19, which is the RT-PCR, that is the similar development of the diagnosis for SARS-CoV. Viral culture are not recommended. So the objective of this study is we want to find out the importance of the laboratory diagnosis of human coronavirus infection in order to limit the spread as well as to appropriately treat those patients who have a serious infection. Next. There are three methods has been done in this study. Firstly is the pre-analytical issue. In the pre-analytical issue, the initial respiratory tract want to collect the specimen collection for the diagnosis and also the screening for the patient. Firstly, within 5 to 6 days of the symptom, once appear to the patient, required a nasopharyngeal swab or as an oropharyngeal swab are recommended for the screening or the diagnosis of the early infection. Secondly, another alternative option of collecting sample can be the self-collected saliva specimen. After collection, the swab has to be placed in a viral universal transport medium for a rapid transportation to the clinical microbiology laboratory. Ideally, it's better to keep under refrigerator condition. Secondly is the late detection and monitoring of patients with severe COVID-19 pneumonia. Sputum sampling or the bronchoalveolar lavage should be used for the collecting lower respiratory tract specimen. Last method is the safety measurement for specimen processing for PCR process and the testing. So real-time RT-PCR method is recommended for the molecular testing.
So for the result, there are two types of method that Divya mentioned just now, which are molecular and also the serology testing. So for the molecular, as the report, there are two different country, which is United States and also China. In the United States, if nucleocapsid proteins N1 and N2 test positive, a case is considered to be laboratory confirmed. So it looks to the CT value, which is if the CT value is lower than 40, it considered as positive test. Whereby CT value higher than 40, it will be negative test, and CT value below 40, but it's one of the N1 or at the N2 is considered as indeterminate or that's require to be testing. So for the China, the assay with 3 targets, which is positive for 2 or more targets, are considered positive. So the lower CT value indicating high viral loads may be used as an indication of transmissibility. For the serology part, for the detecting serum antibody against S proteins for the coronavirus part is the one that we want to see in the serology method. So S proteins are determined by the S genes and are functionally divided into 2 subunits, which is S1 and also S2. For the S1 is for the receptor binding, S2 it will be fusion. So S1 it will be bind to the receptor. So antibody and protein, as said just now for the molecular, is play role in viral pathogenesis, replication, and also RNA packaging. They look into the this thing. They look into this thing. So seroconversion occur after 7 days in 50% of patients as a report. So next is discussion.
As per discussion, as Divya mentioned just now, there are 3 stages, which is the pre-analytical stages. In these stages, they collect the proper respiratory tract specimen at the right time from the right anatomic site. And the next stages is analytical stages, which is the assay selection. And third stages is the post-analytical stages. These stages is for interpretation of the result. So for the back to the first stages, which is the pre-analytical stages. In here, they use nasal cavity, which is mostly patient will feel a flinch, which indicates that the swab has successfully reached the target. And the swab should be swirled 3 times and maintained in place for 10 seconds. And swab should have flock harmless synthetic fibers such as polyester as well as synthetic nylon handles. And next method is self-collected saliva specimen. And also they can use sputum sampling or bronchoalveolar lavage, which is the swabs should be placed in the viral transport medium after collection and transport quickly to the clinical microbiology laboratory and also preferably under refrigeration. Next, for analytical stages, which is the assay selection, they also have immunoassay, which is this is a rapid detection of SARS-CoV-2 antigens, or known as antibodies, IgM and also IgG. They also use the rapid antigen lateral flow assay, which is the advantages of this assay is it is fast time to result and also low cost detection of SARS-CoV-2. However, there are a few disadvantages, which is it is poor sensitivity early in infection. Next, we have serology, the one that Ian mentioned just now. Serology monitors the host reaction to infection and is best used retrospectively as an indirect measure of infection. So basically, serological approaches are fast evolving and have proven to be effective in verifying previous COVID-19 infection. Other method that they found out is they can be used random amplification deep sequencing, which is it determine the future mutation of SARS-CoV-2. And they also can use real-time RT-PCR assay. Basically, the advantages of this assay is amplification and analysis are done simultaneously in a closed system to minimize false positive result associated with amplification product contamination. Next, they can use loop-mediated isothermal amplification. The next assay is the multiplex isothermal application and also microerror detection. Lastly, they can use CRISPR, which is the clustered regular interspaced short palindromic repeats based assay. Next, for last stages is post-analytical stages, which is that I said just now. This stage is for interpretation of results. So for the interpretation of molecular result, they indicates the low CT values indicating high viral loads may be used as an indication of transmissibility. Next, for test of cure and test of infectivity is they can make a self-quarantine for up to 1 month and has been recommended. NP and OP swab may not be sufficient for either a cure or an infectivity test, but more research is needed in this study. Last one is for serology of COVID-19, which is they found out the N protein, which is it is a structural component of the helical nucleocapsid. It is a viral pathogenesis, replication, and also RNA packaging. In this, antibody to the N protein are frequently detected in COVID-19 patient, which is it suggests that N protein may be one of the immunodominant antigens in the early diagnosis of COVID-19. Next. As a conclusion, it is hard to estimate the necessity of rapid development of integrated random access point of care molecular devices for reliable diagnosis of SARS-CoV-2 infection. These tests will be critical for real-time patient treatment and also the infection control choices, especially when other less infection forms of pneumonia are present and respiratory isolation resources are limited. Basically, all the assays that I mentioned just now are safe, simple, and quick, and they may be utilized at local clinic and also hospital that already have the necessary equipment and are in charge of identifying and treating such people. That's all. Thank you.